Hello, everyone. Today we're going to be doing the lymphatic system review, and we're halfway. We just have a few systems left to do the whole review. Buddy's going to join us. He's going to be in and out. He just wants to be next to me the whole time. So anyway, I hope somebody joins live. And if not, you can always watch it later. I hope these reviews are helping you. So let's jump right on in. I don't see anybody on yet, but I'm sure somebody will. So let's get started, guys. I hope you guys are doing well. Oh, somebody is saying hi now. I tell you, right as I'm getting ready to teach. Darcy, Chantel, Maria, Aristotle. I know you're not Aristotle. All this time I thought you were Aristotle, and you're not. So good morning. Welcome. Darcy, tomorrow on lymphatics. Oh, yeah, we're doing it today. So then this is a preview then for you. Teresita, Linda, Teresa, thank you. Thank you for being here. I really appreciate you guys being here. And like I said, we're going to have my buddy here in and out because he's Alan, Ricardo, good Mendoza. Good morning, Sara or Sarah. I have a Sara and a Sarah in my class. So just finished this chapter. Good. So this is a good review. Patrick Leos. Good. Wow, Patrick. Good morning. Welcome. I'm so glad you're here. We're going to do the lymphatic system review. So we'll start. I won't be able to come up and watch the comments. So as usual, we're going to go over the anatomy, the physiology. And so we're going to list the structures, describe the physiology processes of the lymphatic system, discuss lymph, which is the liquid part, the lymphatics, the lymph movement, and the lymphatic organs. So we're going to start with lymphatic system. It collects interstitial fluid and nutrients from the digestive tract and delivers them to the cardiovascular system. So it's a closed system, and it's not circular like the cardiovascular system. I've already done that review, and if you guys can remember, the cardiovascular system works circularly, and it has the pump is the heart, so it pumps the blood. The lymphatic system doesn't have a pump, but it moves one way. It doesn't go circular, it moves one way. Immunology is the study of, immune responses. Remember, ology is study of. So, lymph, let's talk about the anatomy. Lymph is the liquid part, okay? That's what's, inside already. The lymph nodes, it's lymph. If it's in between the cellular tissues, it's, intracellular tissue. If it's in the blood, it's plasma. And plasma, remember, is not, 90% water, so we really got to be drinking that water. The lymphatics is part of the anatomy, and it collects terms for structures along the lymphatic chain, like the capillaries, the vessels, the trunks, the ducts. Lymphatic structures are the lymph nodes, the bone marrow, the thymus, and the spleen. And lymphatic tissues are present in the GI tract. I don't know if, when we did the digestive system, I mentioned the Peyer's patches, that's part of the lymphatic system. So there's, lymph tissue throughout the body because it's keeping guard. Remember, think of the lymphatic system like it's your detox system, like it's your guard. It's on guard looking for pathogens all the time. And lymphocytes are your white blood cells that, are looking for those pathogens. The physiology of the lymphatic system is that it removes excess interstitial fluid. That means, interstitial means in between the tissues, transports fats and soluble vitamins, and protects the body through defense mechanisms. And I really want to talk about that part because especially nowadays, we need to have our, to understand and realize that we have an immunity in our body. We're born with everything we need equipped to fight off pathogens and to survive. So the lymph is the liquid and the fluid circulating through the lymphatics derived from interstitial fluid. So it's named different depending on where it's at. If it's interstitial fluid, it's in between the cells. Once it goes into the lymphatics, it's lymph. Once it goes into the cardiovascular system, it is plasma. So it's three different things, but it's the same thing depending on where it's located. Interstitial fluid found in extracellular. I always get ahead of myself. When interstitial fluid enters the lymphatics, it is called lymph. After lymph is filtered, it is returned to the blood. And yesterday I posted on Instagram this really wonderful little video where, it shows how, it's draining, from the subclavian veins on the right and left, subclavian vein, and it's drains it back. That's when it puts it back into the, circulatory system. So I don't know. I'm just fascinated by the body. That's the name, massage nerd. I'm a massage nerd. I hope you guys are too. So plasma, interstitial fluid, and lymph are the same fluid. I already said that. So it must be repeated a few times in order for us to kind of let that sink in a little bit. So the lymphatic capillaries begin in tissue spaces as close-ended sacs. Oh, okay. They have anchoring fibers. So the lymphatics have anchoring fibers so that it doesn't move around too much. Okay. The excess interstitial fluid and tissue expansion stretch the anchoring fibers to open up the valves. It has valves like the veins. Remember I talked to you about the veins, that they have one-way valves so that the blood doesn't backflow? Well, the lymphatic system has the same thing. It's got little veins that open with pressure. When the pressure is greater inside the lymphatics, then it pushes the lymph in, and it makes it close back up. So the anchoring fibers are to keep it in place. The excess pressure in capillaries closes valves so that the fluid doesn't escape. Lacteals are the lymphatic capillaries and villi of the small intestine. They absorb dietary fats and soluble vitamins and take it back into the circulatory system. Oh, and I'm going to show you, because I think this is so important to show you, the lymph capillary. So here you have the little anchoring fibers. These are the anchoring fibers so it doesn't move. I'm trying not to give you the glare. You guys see it better? The anchoring fibers. The lymph flows one way. This is direction of the lymph. It goes one way. It doesn't backflow. And here it goes in. They look like shingles on a roof. There's a lot of little shingles, and see, here's the valve, an open valve right here, and here's a closed valve. Okay, so once it picks up the interstitial fluid, interstitial means in between, so it will be outside, interstitial fluid in between the tissues, then it pushes it inside, the lymph capillary, and so then it goes and it becomes lymph now. Okay. So this is interstitial fluid outside, lymph inside, and once it takes it back to the bloodstream, it becomes plasma. So the overlapping endothelial cells right here, they look like, like shingles, and here's the fluid entering the lymphatic capillary. So it goes in, like that. The little arrow shows you, and this is the direction, one way. It doesn't have a pump like the heart. So I want to talk about that, how exercise is one of the ways that you move the lymph. Buddy, you're in the way of progress here. Such a good boy, huh? Okay, so lymph capillaries merge to form lymphatic vessels and contain valves that open in one direction. The lymphatic vessels merge to form lymphatic trunks. So it keeps getting bigger. It's kind of like the branches on a tree. They're smaller, and then it keeps getting fuller and fuller. Lymphatic trunks merge to form lymphatic ducts, and the lymphatic chain is similar to a tree, progressions of twigs, capillaries, and to branches. So it keeps getting bigger and bigger and bigger until it's so full, and it brings it to the right thoracic trunk, and then the left thoracic trunk. I'm sorry, I'm getting a right lymphatic duct, which would be this side of your body, waist, from here to here and everything on your right side of the body. And remember, we're using anatomical position. You're always talking about the client, okay? So the right lymphatic duct drains the right side of the head, neck, right upper extremity, and upper trunk, okay? The rest of the body, the legs and everything else, is the drains in the thoracic trunk and delivers lymph to the subclavian vein. And that's the picture that I posted on Instagram. Please follow me on Instagram, Massage Therapeutics 915. I do my best to post a lot of stuff there, you know, pictures, videos, massage videos about my life, about Buddy, you know, just about anything. So please, you know, follow me there. And let me just take some tea. Thank you, Sara, for my cup. Look, I'm using my Christmas cup from you. And delicious tea that my students gave me too. So lymphokinesis is the movement of lymph. It flows in one direction towards the ducts that drain up here, okay? Lymph moves by a milking action from skeletal muscles. Thus, the reason it's so important for us to walk and exercise and get moving at least 20 minutes a day. Also by massage, you know, when we give massage, we're moving the lymph. You know, bandages, you guys, you know, when people are in the hospital, sometimes they put these compression bandages, you know, because they're not moving, they're sedentary. So just to keep the lymph flowing, contraction of smooth muscle. Breathing is another one that moves the lymph. So it's very important for you to take deep breaths. Besides the fact that it calms you down and reduces your blood pressure, you know, it also moves the lymph. So deep breathing, exercise, getting enough sleep, you know, getting your massages. I know right now we're not, right? It's like, I can't wait till I get mine. It's been 2 months. So I know what all our clients are feeling like, oh my God, that we just want to be able to get back to massaging with precautions, obviously. Bandages, water submersion is another way to move the lymph. And the lymph goes, you know, one way. So when you give a lymphatic massage, and I don't give a lymphatic massage too much. I just know certain techniques like the lymphatic pump, you know, where you pump from the feet or from the chest, you know, you push. So they have to be gentle and slow. The pressure that you use when you giving lymphatic massage, it's only the pressure like of a nickel on your skin. Okay, you don't use a lot of pressure because the lymphatics are like tissue paper. They're very thin and they can break very easily. So when you're giving a lymphatic massage, it's always towards the draining ducts and it's done very slow, you know, with very gentle little pressure. And to tell you the truth, it drives me nuts. It's like it's really hard for me to receive a lymphatic massage. However, I know it's very beneficial, especially for people that are sedentary or have severe edema or are in the hospital. So lymphatic massage really has its place. So, okay, let me get off track here. Oh, it's got lymphatic organs, just like the digestive system has accessory organs, so does the lymphatic system. So the primary production of maturation are the lymphocytes. Remember that the white blood cells are produced in the red bone marrow, and some of them mature in the red bone marrow, and some of them mature in the thymus. And it's in the next slide, I think. And then the secondary lymphatic organs are populated by lymphocytes, which are, you know, lymphocytes. The suffix "cytes" means cell, lympho means lymphatic. So it's populated in the lymph nodes. The lymph nodes are the little bean ones that you feel like in your neck, in your axillary area, and your groin area. When they're swollen or you have an infection, they feel a little bit bigger, you know. And then you have your mucosa-associated lymph tissue, which is the MALT. You know, M for mucosa-associated, A for associated, lymphoid for the L, and then tissue. So MALT is the acronym. So mucosa-associated lymph tissue, that's throughout our body, and we'll talk about that too. And the spleen. The spleen is part, an accessory organ too. And the spleen looks like a large lymph node, and it filters blood just the way our lymph nodes filter, pathogens and, get rid of any toxicity that we might have. So does the spleen. Sorry, I'm short of breath today. I think I've been walking still outside and allergens are so high that my throat has been raspy. So, okay, produces blood cells. Lymphocyte is a type of white blood cell. Some lymphocytes remain in the red bone marrow to complete maturation. So think of B cells, they mature in the bone marrow. T cells mature in the thymus. So the B for bone, T for thymus. Remember, your thymus is right here, and it's very good for you to tap it because it stimulates, the T cell maturation. So the thymus receives immature lymphocytes and completes maturations. They're T lymphocytes, T for thymus. They produce thymosin and thymopoietin. So those are two proteins that that it produces, and they filter the second. Let's talk about the secondary now. The secondary organs, they filter the lymph. So think of your lymph system as your own toxic, to get rid of toxicity, and like as your own cleanse. Like if you do, some people, like to do cleanses and detox. Well, your lymph does that for you. As long as you don't tax your lymph by overeating and not working out or not walking, as long as you help your lymphatic system, it's your friend. It's there to help you detox and build, you have a built-in immune system. So superficial clusters are in several regions, and they enlarge during infection, like your cervical nodes, axillary nodes, and inguinal nodes. I guess Buddy got tired of listening to me because she's not paying attention to me. He just went to lay down. So small groups of lymphatic tissue in the respiratory tract. Peyer's patches are in the GI tract. Tonsils are full of interferon, and before in the 70s is like they thought tonsils weren't good for anything, and so they removed them. But they're part of your lymphatic system. They're part of some of the first defenses. The interferon, it would catch in our tonsils. That's why people would get tonsillitis, because it prevents it from getting into your system. Peyer's patches are in the small intestine, and the vermiform appendix in the cecum of the large intestine also has lymphatic tissue. So lymphocytes in the spleen destroy or inactivate pathogens in the blood. And remember, the spleen recycles blood. Old blood cells, it's called the graveyard of the circulatory system because it recycles old blood in the spleen. It also stores lymphocytes and blood when needed. Like if you're bleeding a little bit, the spleen will release some blood into your system. Okay, resistance to disease. Now we're getting to the nitty-gritty of it. Resistance is the body's ability to counteract effects of pathogens and foreign substances through our defense mechanisms. Susceptibility is when you're susceptible, your lack of resistance. Like with this virus right now, one of the things that you're susceptible is if you're older and you take medication and you have certain illnesses, diabetes, high blood pressure. Some of this makes you susceptible to diseases because that means your immune is a little bit low. Your immune system's a little bit low. That's what susceptibility means. There are two different mechanisms, like non-specific and specific immunology. So non-specific, it attacks everything. Defense against pathogens and foreign agents, barriers, cellular responses, and inflammation is part of, non-specific. It's just anything that comes in, it just attacks it. It doesn't know what it is. It's taking care of you. Specific is provides immunity and involves B and T cells, and it's the proteins marking certain pathogens so it can recognize later. Like our body's so smart. Some proteins poke hole in pathogens so that they can deflate and die, or they mark them. They put a code in them to say, "Oh, I remember you. You were the virus that I caught in 1970, and I remember you're a bad guy." So it remembers. Your body has very specific immunology, and that's Oh, your first line of defense would be your skin. Remember, our skin is slightly acidic. We have an acid mantle, so that takes care of that's our first line of defense. Our nose hairs, our ear, that's why they tell you don't touch your face, because we don't want to bring it in. It goes in through the pores, through our holes too, from our face and eyes. Sweat and sebum secreted by our skin glands, the cilia and the respiratory mucosa, and the sticky mucus in our nose and mouth. I just call it gunk. Ooh. Okay. The body's second line of defense is activated when microorganisms penetrate the first line of defense. So if anything gets through, let's say your skin, let's say you've been using lotions and potions on your skin and it doesn't have an acid mantle anymore, so let's say that the pathogens get through, they get inside, so then now the big guns come in. Now they got to call in, the activated when microorganisms penetrate the first line of defense. They call on the non-specific white blood cells. That's the non-specific, that's the second line of defense. And then specific is the third line of defense. Okay. Protective responses to tissue damage results from several causes, including infection or trauma. The purpose is to eliminate pathogens and foreign agents, removes damaged tissue, creates an environment that maximizes tissue repair. I'm talking about inflammation. Inflammation is there for a purpose, guys. It really does protect us. It keeps you from moving that body part, and it helps the tissue to repair itself. So if it didn't do that, you'd keep going, right? If you didn't have that swollen, somebody just told me the other day, my finger's so swollen, I can't move it, and right away I thought, I'm going to use that as an example when I teach, because when you cut your finger, it swells so that you stop moving it, first of all, so you don't keep injuring it, and so that it can repair itself. So inflammation is there for a reason. So, we need to learn about SHARP, which is swelling. First it swells, and it feels heat, it feels hot, and then a loss of function, you can't move it. It's red usually, and you have pain. And those are all to protect you. It usually lasts, depending on the cut or the injury, 4 to 6 days. Acute inflammation is when it's a more severe injury, and it's more obviously than 3 weeks, right? Systemic inflammation, that's when it's widespread inside your body, not confined to specific regions associated with infection. Fever is common. Fever serves a purpose too. Just like inflammation, fever kills the pathogens. It raises your body temperature to to kill the pathogens. This is why I always say, let the fever run for at least a day or two. Don't start taking all this, to reduce your fever, all these medications to reduce your fever, because it's killing. The fever's there for a purpose. And I don't mean if you have 103, 104, by all means, take whatever you need. But usually let the fever run for a day or two so it can kill all those pathogens inside of you. Like I said, your body's equipped to fight off any infection if we would just help it and leave it alone and let it do its thing, because then it gets confused. Okay, chronic inflammation is more than 2 weeks, and it's seen in several pathologies like autoimmune diseases, rheumatoid arthritis, respiratory diseases, asthma, cardiovascular diseases, digestive diseases like Crohn's disease. So we have our third line of defense would be provided by the B cells and the T cells. Remember, B, they mature in the bone marrow. T, they mature in the thymus. Oops, I just hit my microphone. Immunity is the body's ability to recognize and respond to pathogens and foreign agents. It can be acquired naturally from simple exposure or artificially through vaccines. So that's what vaccines do. You know, back in the 100 years ago, people used to die more from contagious diseases. Thank God for vaccines. And that's the scariest part about now, that we don't have a vaccine yet. Because we don't have anything, you know, they inject you a dead part of it, obviously, you know, so that your pathogens can recognize it for later. See, our body is so smart that once we've had it, it'll recognize it. You know, the proteins, you know, tag it. They tag it and they say, okay, you've been here. You're a deadly one, or, you know, this was a cold, but it recognizes it, you know. So the more we eat healthy and exercise and build up our immune system, get that vitamin D in you, and get enough sleep and don't stress, your body will help you fight off some of these illnesses. Okay, T cells are responsible for the self-mediated immunity. It attacks invading pathogens and foreign agents. Specialized T cells, like the CD4 and CD8, activate immune cells. And actually, these are the ones that they test, like when you have, you know, like let's say HIV. If these numbers, you know, are off, that's how they know. Okay, so they test for these, you know, these proteins and these cells in your body to see if your body is fighting itself. Because there's some, you know, sometimes like diabetes, your body's, you know, is not able to recognize anymore that it's attacking itself. B cells are responsible for antibody-mediated immunity. It produces antibodies when they encounter foreign agents and direct other immune cells to attack it. So you have your own little army, guys. You have your own little. I remember when I was little. When my kids were little and they were sick, I would tell them, "Imagine Pac-Man. Imagine Pac-Man coming and eating all the pathogens. You know, all the bacteria." And back then it was Pac-Man. But visualization is so important. And I know that there was a doctor, and I forget his name, but there was a doctor that he used to help cancer patients heal themselves by imagining, you know, using your imagination, a Pac-Man or a zombie or whatever you want to imagine that's, you know, familiar to you right now, that you can identify with, you know, eating all those pathogens inside of you. You know, visualization is so important, guys, that if you can imagine your attack cells, you know, your killer cells attacking any illness, any pathogen inside of you, you know, bombard. I know my daughter likes to think of them as exploding, you know, so we all have different mechanisms inside of us to help us to get rid of, you know, these diseases. And I mean imaginary, that you can imagine something different. Your body will still do that. And the more you empower your body, you know, you will be okay. This is an important time to build up your immune system, guys. I'm serious about that. Immunodeficiencies is the failure of your immune response to protect your body from pathogens. Hypersensitivities are people that have allergic reactions like me, you know, that I've been walking outside and my throat is a little bit dry. You know, I've been really, it's harmless. It's not, you know, something that I'm going to get sick from, but they're allergens, and probably maybe I've been eating too much and my body's not, you know, being able to detox on its own. And that's one of the things when the immune system, when your lymphatic system starts failing, is because you're bombarding it by eating junk. You're bombarding it by, you know, not exercising. You're bombarding it by all the junk food, the sugar, you know, or the flour that we eat. So it can't keep up. So it starts failing. It starts backing up. Remember, your lymphatic system gets rid, you know, it's your detox system. Whatever your circulatory system can't get rid of, whatever your digestive system can't get rid of, whatever your, what's the other system? Your kidneys, whatever they can't get rid of, it goes into interstitial fluid, and then the lymphatic system absorbs all of that crap. Well, I shouldn't say crap. Interstitial fluid, sorry. It absorbs all the interstitial fluid and sends it back to the, circulatory system. So that is your first defense, guys. Eat healthy, get exercise, help your immune system. It doesn't have a heart like the circulatory system. It needs your help. By walking, by exercising, by moving, yoga, tai chi, get moving, help your lymphatic system to work properly so it can keep you healthy. Sorry, that was my 1 minute tangent. Autoimmune diseases is inappropriate or excessive immune response. Body no longer recognizes healthy tissue and it attacks it. And that's what happens with like diabetes, HIV, So anyway, that's pretty much it. There is a lot of, immunologic pathologies, lupus is another one. I had a friend that had lupus for many, many years, and lo and behold, she'd been taking medications for it. And this is actually I shouldn't even tell you guys, but like 15 years later, after taking all this medication, she went to another doctor. They did a test and they told her she didn't have lupus. All along, she'd been taking the medication. But anyway, some of the things that I hear, in the massage room are kind of scary at times. But I encourage you guys. I was excited to teach you today the lymphatic system for the simple reason to remind you that you have what it takes to fight off infections, bacteria, viruses. Eat healthy, exercise, sleep, don't stress, take your deep breaths. Breathing helps, to move the lymphatics, If you want to learn, lymphatic massage is very beneficial, guys. Maybe you can take some courses on lymphatic massage and get that lymph moving. And if you don't, just do some of the, where the lymph nodes are, in the axillary, the neck, you can massage them, and always massage them towards where they drain right here, so it's your body is a miracle. I've always said that our bodies are a miracle. We're equipped to survive if we help it and we don't abuse it. And I know most of us do abuse it. Trust me, I did too. If it wasn't because I believe in health, I'd weigh, like 500 pounds probably, because I love to eat. However, I do try to limit, I do my best not to abuse my body, guys. I really want to respect that, it's my temple. It's my temple. It's the only body I have. It's the only body that I need to take care of. So I encourage you guys to do the same. Take care of your bodies and it'll work miracles for you. So take care, stay healthy. I hope you enjoy this lymphatic review. And until the next time, I'll see you. And by the way, somebody's leaving me a long comment. Thank you you're welcome, Darcy. I'm glad you enjoyed it. The next one, I don't know. I guess I'm going to leave the nervous system and the endocrine system till the end because they're the longest and the most difficult ones. So I think I'll do maybe the respiratory next, and urinary. We don't have that many. I'm probably going to skip the reproductive system. And I have a very good reason for that because there's a lot of words in the reproductive system that I'm afraid YouTube is going to flag me and turn me off. When I start pronouncing some of those words that I don't want to say, like proper names, for the reproductive system. But from what I understand, YouTube, electronically listens for certain words. Like if I was cussing a lot or using certain words, they would flag me and shut me down. So I might skip the reproductive system or maybe leave it till the end and take my chances. But we'll see. We're more than halfway done, guys. This is what I tell my students. We're more than halfway done through A&P. And I know it's different teaching it on YouTube. You only get half an hour of a review. And the class is a little different. I always have projects for them. We have a little video, and then I have projects for them, to do, which is very important, or guest speaker or whatever. But anyway, I hope you guys stay healthy and strong. And I'll see you Friday for Tai Chi. And until the next time, create a great day. Thank you for tuning in, guys.